Hi, good evening and welcome to the second webinar in the Launching a Longevity Clinic series. Tonight we're going to be talking all about weight loss and how to manage that in a longevity clinic. We're going to be touching upon how you can alter diet and lifestyle using things like intermittent fasting and caloric restriction for your patients to ideally optimize their weight. We're also going to be talking about supplements that you can implement, but also talking about Ozempic, we're talking about semaglutide, talk about Wegovy, we're talking about Mounjaro, all of these different medications that you can implement into your clinic, how to start them, how to proceed with giving these to your patients, and also how to stop them when you come to the end of your treatment and how you can successfully transition them into a diet and lifestyle plan. We're also going to spend about 15 to 20 minutes at the end of this webinar talking about our new courses that we are going to be launching very soon. There's going to be an exclusive opportunity for those who stay and watch to the end of this live session. And do remember, this is a very interactive session, so please start popping your questions into the comments now, because we will see those questions, and I'm joined by colleagues here today, and we're going to be answering all of your questions you have. Try and keep it focused on weight loss, but if we have time, we can open up to other things regarding longevity. I'm joined here by two of my colleagues.
Hi, I'm Dr. Abs. I work with Dr. Matt at Apex Medical. I've done a lot of research into longevity. I've worked in it for many years. I treat a lot of patients for this as well. And we're also joined by Dr. Amrit as well.
Hi everyone, my name is Dr. Amrit. I'm a purely cosmetic doctor, and I work with Matt and Abs in the cosmetic sector. I've done medical here on running training courses as well as working within a cosmetic clinic, namely specialising in dermal filler, botulinum toxin type treatments or skin rejuvenations. But today I'm very much like yourselves interested in understanding how do we as clinic owners or aesthetic practitioners, or even just generally as an anaesthetist background medical doctor, trying to implement these weight loss treatments into our clinics or into our clinical practice. So, I mean, I've really enjoyed the webinar last time with you guys, and we've got a number of questions already. So for those actually already kind of watching live at the moment, do drop your questions into the comment section down below so we can kind of go through them one by one. And we'll focus it specifically today on weight loss, although the longevity training that Apex is providing expands beyond weight loss as well, isn't it?
Absolutely.
So do you guys want to talk a little bit about what the kind of training will encompass, what sort of segments and content?
Yeah, absolutely. So we're going to talk more towards the end about how you can get more involved in our courses, but it's really good, as you say, to know how does weight loss fit into longevity. So weight loss is obviously just one step in the longevity pyramid that we talk about, and we've got to always think about that longevity pyramid starting with that diet and lifestyle changes, because nothing can really happen in longevity unless you change diet and lifestyle, because they are the two of the most important things you can really do for your patient. And changing that mindset and that approach to food, the approach to exercise, the approach to eating windows, fasting windows, and getting these concepts into your patients' minds. But also then building up from that into obviously managing hormones. And the third step in that longevity pyramid is weight optimization. So that's really where weight optimization comes in. Once you are optimizing weight, then you can start thinking about performance optimization, healthy aging, and so forth. But really, to look at weight optimization, you've got to get the other two layers cracked first. You've got to get the diet and lifestyle sorted, and you've got to get the hormones managed too, because you might notice some people coming into your clinic with weight loss issues or weight gain issues, and it might be that they are a 40, 50-year-old lady, and they might be going through the menopause or perimenopause. So that's got to be something you've got to address first before you even come on to managing weight. And same for men, 50-year-olds who might be having a low testosterone level. That's all going to be linked into weight gain too. So you've got to really go in that stage-wise progression that we have in longevity medicine.
Similar to aesthetics actually, which obviously you still do quite a lot of. If someone comes in with a lot of weight and they want jawline definition, I mean, there's only so much you can achieve, right? And it's not just visually, but internally as well.
Now, so focusing on the weight loss, you guys mentioned a lot of specific names. Wegovy, Ozempic, Mounjaro,
Yeah.
GLP-1 agonists. Tell me more about what the difference between these are, and what, I mean, all I've been aware of is Ozempic seems to be the number one. There's a shortage of it. There's lots of flags out there as there's not enough diabetics, and now there are alternative options out there. And if you look at the spectrum of weight loss, of course you can just reduce your calorie intake, but that's lifestyle factors that people are usually not that compliant with, and there might be underlying causes. You can go as far as having gastric surgery, bariatric surgery, to reduce your stomach and how much you can take. Now, where do these sit between that spectrum, and what kind of considerations would you need to have when addressing a patient for weight loss to put them onto these?
Well, I think you've mentioned something very crucial there, which is when you look at all these things, one option is a gastric bypass, right? Now, it's interesting you say that, because when we look at the context of these drugs, and that's really important, because it's easy to just say this drug does this, that drug does that, but actually if you understand the history of it, it becomes very easy to understand where all of them fit. So they noticed that when patients were having gastric bypass surgery, within a week their diabetes was gone. And they couldn't really work out why, even if they were quite fat. But what they did was they looked at the serum testing, the blood test of these patients, and they found that when we look at the blood of these patients that have had the gastric bypasses, they have very high levels of incretin hormones. And then they realize, okay, well, there's something going on here, and that's where it all started from. And so when we look at incretin hormones, there's really four main ones. There's GLP-1, which you've just said, which is a glucagon-like peptide one. There's GIP, gastrointestinal inhibitory polypeptide, I believe. And then you've also got PYY, which is peptide YY, or peptide tyrosine. Y is the single letter code for the tyrosine amino acid residue. And then we have CCK, cholecystokinin. The latter two aren't really made into drugs now, but they work in different ways. So CCK also works on the gallbladder. But the GLP and the GIP, we have turned into drugs. So the history is that they've come as a result of seeing what happens after gastric bypass surgery, and they have this ability to basically slow the rate of gastric emptying. And that's what's happening. So the food from your stomach going through your intestine, I'll pick a round number just for argument's sake. Let's say that takes 100 minutes, just for a round number. In this, it's going to be much more than 100 minutes when you have these drugs. And there are risks and benefits, like any drug. But in essence, that's what it's trying to do. So the GLP, glucagon-like peptide, you can tell what it's trying to do. It's trying to mimic glucagon, essentially. And there was a thought process that it should increase the amount of insulin as well. Because what they do is they increase the insulin response to food. So if you just inject like GIP when you're not even eating, it's not really going to do anything. But when you do it after a meal, then you get the effects that you're after. Now, in terms of increasing the insulin spike, it's been shown in vitro to do that. It's been shown in animal models to do that. But it's debatable whether it does it in humans. Even the chief scientist behind the most popular one, Arne Ostrop, showed actually it doesn't really work the same way in humans. And that was then followed up by studies in Harvard by David Ludwig, an incredibly renowned researcher. So as to whether it increases the amount of insulin in humans is debatable, but we see the effects and what it's doing, mainly through slowing gastric emptying.
And I think when you were saying, Amrit, about how that fits in with regard to the diet lifestyle and people who might be considering gastric bypass and things, I mean, obviously BMI is a bit of a crude tool, but it's a really helpful one to give a rough idea about where people are sitting on this. And obviously, we've got the NHS guideline. The NHS give these medications if they're BMI over 30 or if they're less than 30 but have some of the complications of obesity, such as diabetes. But actually, these are just the NHS guidelines. This is when you get funding for it. And actually, the guidelines, we can actually step a little bit outside of these, but you've still got to bear in mind that you don't want to be giving these to patients who are, BMI 23, 24, okay, because there's a lot of bad press out there about, celebrities taking skinny jabs to lose a load of weight, crash diet sort of thing. And that's not really what we're trying to do in longevity medicine. What we're trying to do is actually reduce the risk of disease, reduce the risk of that sort of metabolic burden, that obesity, that fat that you've got, particularly around the viscera. So actually, when you're sort of thinking BMI, sort of anything over 25 is sort of getting into that category where you start considering it as an adjunct. Anything over 30, I usually would treat people over 30 quite happily with my GLP-1 agonists, and we talked about risks and benefits. We'll talk more about that later, I'm sure. But the risks for me, the benefits outweigh the risk when you're sort of getting over that BMI of 30, or you've got those sort of complications that are coming with it. As for a higher level of BMI, now this is a really good question. I don't know about you, Abs, but is there a higher level of BMI that you wouldn't give someone a GIP and a GLP-1 agonist? Well, as Abs has said, a lot of the benefits, or some of the benefits of the bypass surgery is that hormonal change in these incretins and actually changing that. So actually, and you see these huge weight losses of people who've got BMIs of 50. Actually, they can do it through diet and exercise. I've seen it. I've worked in a bariatric firm at Chelsea and Westminster, and actually they will see that actually you can lose this weight by diet and exercise. So there isn't for me a top end that I would say, no, I wouldn't give you a GLP-1 or GLP-1. I don't know what you think about that.
It's interesting. I mean, for me, there are most of the time when patients come to me for weight loss, I actually do it without these drugs. I personally prefer to do it without these drugs because there's no risk then. The patients I generally tend to do it for is the top end, actually, interestingly. Generally, I tend to do it for patients who are so big they can't leave their house, and I've had a handful of those that I can count on one hand. And in that situation, I think if you don't get your glucose levels down, you're done for. And in that case, there may be risks of these drugs, but there's also a risk of not using them.
Yeah.
And that's what we're trained for. That's what our profession is for. So in that situation, I personally I prefer to use them actually, to give them some kind of head start.
Yeah, I think it helps try and change that association people have with food, because one of the big things that you have when you are obese, you have this relationship with food, and you have these responses, a bit like a temperature response. If you sit in a normal thermoregulatory window, if you get too hot, you shiver, you take a jumper, you try and cool down. When you're being obese for so long, your weight sits in that window. So when you start losing weight, your body says, oh no, I need to keep every bit of energy I have
Go back to what I was
to
before.
go back to what I was.
Homeostasis.
Exactly right. Exactly. That has that same effect in weight management. So actually you find it's really difficult for people to lose that weight. So actually changing some of these signals and these GLP-1 gels, although they're produced locally in the gut, they actually work on systemically in the brain as well, and they can actually change these cravings and change that association with food, and it's really helpful to kickstart these changes.
So, as a layperson to longevity, I'm going to summarise what you guys expertly said. So, when it comes to things like the GIP agonists, we're looking at something that's going to delay gastric emptying, so your stomach is fuller for longer, which reduces the urge to want to feel hunger because you're not going to have the ghrelin and all the hunger response hormones coming back in quickly.
It works with the central nervous system as well, so it makes you have the feelings of satiety for longer.
Okay. Now, lots of questions are already coming in. I mean, a lot of them are kind of along the similar lines. Risks of these medications seem cropping up quite high. I mean, I've actually got someone who works in a slimming clinic saying a lot of their patients are scared of Manjaro because of thyroid cancer information. Similarly, when it comes to Ozempic, are there risks? I know a lot of people are taking these longer term now rather than short term. What should we know?
So there are risks just like with any drug, and whoever it was that was concerned about those risks, like, I take my hat off to them because that's the correct perspective to have. You should always ask what are the risks. I won't get into too much detail because I tend to have a habit to have a So essentially what you're doing is akin to starvation, okay? Long-term starvation is obviously not a good thing. And the thing is, when you go on these drugs and you lose the weight, and you look at studies that report on, let's say, semaglutide, what you find is, let's say you lose a certain amount of weight, whatever kilogram or percentage you want to think of, a portion of that is going to be lean mass as well. Because when you intermittently fast, you have benefits, as I'm sure we'll talk about today. When you are starving, you are not intermittently fasting, you are starving. And so you get these issues that come with it. And so you have to be careful along those lines. And when you come off these drugs, it's very quick to put the weight back on if you don't do it right, which is why you have to start with diet. And when you are losing these weights, again, like I said, whatever amount of weight or percentage you want to think of, certain amount of that being lean mass is not a good thing. When else in life do you lose lean mass like that? When you undergo starvation, which is why you find it in poverty and things. And if you're losing lean mass like muscle and bone, so obviously I don't need to explain why that's a bad thing. I think it's pretty obvious. So there are risks like that. There are risks such as gastrointestinal paralysis and pancreatitis as well.
That was one that was commonly coming up,
Pancreatitis
and risk.
I think it's really good to know. I think certainly there's a lot of articles in the media, and you can sort of see these like people getting sick from taking skinny jabs, and you sort of see it. And I see a reflection actually, Amit, from what we saw in the Botox and filler industry. We still see to a bit nowadays, but for 15 years ago, certainly a lot of taboo press, scaremongering, all these things, and it's the same sort of thing. Like back then, people were having problems, complications with filler because they were going to high street beauticians, and still do. But actually, it's the same thing here with in longevity and in weight management, is that a lot of these complicated side effects. So people that have just gone to an online pharmacy, they've just bought the Mounjaro or the Ozempic or whatever it might be. They've ordered that to the house, have taken it for 6 months, 12 months, and not even had a blood test, not had any sort of physician intervention or nursing intervention. No one's actually overseen that. And so Ab says there are complications. This should be managed and treated as part of a holistic longevity plan. And pancreatitis is one of the ones that comes up. So you could look at semaglutide and you can look at tirzepatide. They're the two main ones that we treat. So tirzepatide is Mounjaro, semaglutide is Ozempic or Wegovy. Okay, so they're the two ones that you want to look at. And actually, if you look at them, then because Mounjaro and tirzepatide is a dual GLP-1 and GLP-1 agonist, it actually has more in the studies that you can to look at comparing them, has more of the weight loss, but actually less of the side effects. So you get less of the risks of things like pancreatitis. You actually don't see so much with the Mounjaro. So it's actually knowing what to use, what doses, how to start them on it, and how to increase it. And then, as you say, how to get them off it at the end, because it shouldn't be a lifelong thing. This is always something, when you start a medication, you want to have a plan to stop it.
And when you look at these things like the lean mass loss, that's why it's so important to do under supervision, right? Yeah. So you've got to educate your patient into understanding why lean mass is important. It's not just a visual thing, like it's related to mitochondrial biogenesis, etc., etc. So if you start to lose that, you're more likely to develop diseases easier as well. And that's why I would suggest to people, these drugs are not a primary response. If someone wants to lose weight, don't just shove these in their pocket. You have a conversation about diet, you have a conversation about lifestyle, you educate them all these things. And then if you want to use these drugs, it is in addition to those things, not instead of.
Yeah, and I find sometimes it helps kickstart it as well. Like you get patients who come in, and we all want those ideal patients. Those ideal patients who come in, they change their diet, they change their lifestyle, and then they want this as an extra weight loss. But in the real world, there's a lot of people who want to see some results before they engage. And actually starting on these medications and monitoring it safely, doing the right blood tests, you can actually get a good amount of weight loss. And we're talking like 5 to 10 kilos over the space of 3 months potentially. And you can actually show them this and say, this isn't just water loss, this is fat loss. Yes, there is some muscle loss here too, but you're starting to go in the right direction. Let's now use this. Let's try and change that diet. Let's try and change that lifestyle. Let's try and change your intermittent fasting window. And I talked about that last time, about how I try and increase my intermittent fasting window every time I see my patients. And actually using that to stimulate it is quite good.
So, some really great questions coming in from the audience. So good to see so many of you on the actual the webinar tonight on the chat. I'd love to hear where you're from and what your backgrounds are. If anyone's already in the longevity space or looking to enter, we'll be really keen to hear from yourself. So do drop into the comments below where you're from, what your background is, and if you're already in the longevity space or looking to enter the space as well. So one of the questions I think is interesting is we see underweight or anorexia nervosa and all the other eating disorders that associate with you being underweight as a condition, and there's a psychological component of that. And yet overweight or being overweight is considered to be you just overabundance, eating too much. The developed world seems to be seeing this problem. Now, when it comes to that, is there a psychology associated with an overweight person?
Yeah, absolutely. I mean, one of the biggest links that we find to that is to do with the anxiety that patients feel. So a lot of anxiety patients do it because when we feel anxiety, we psychologically want to try and push it away in our mental landscape, so to speak, or to put it in layman's terms. So when we eat and we suddenly get that dopamine release, it's a way of hiding that feeling of anxiety and bringing in the feeling of satiety instead. So a lot of times when I'm treating people with anxiety and I get them to change their diet and I do all this thing, they say to me, oh, I suddenly got more anxiety. I said, no, you haven't got more anxiety. You are feeling the anxiety you already had, but because you're not constantly shoving food in your face, you have the ability to now perceive that.
So it's a coping mechanism?
Yeah, absolutely. That's what it is, yeah. And so what you find is you are going to come across this in patients that have it. You haven't caused it. You are just bringing it to the forefront and in a bid to try and get rid of it. And the food is highly, highly linked to brain function as well. So if we look at the research of someone like Georgia Ede, who is arguably the world's leading researcher in this topic between food and mental health or brain conditions, she has shown that in practically 100% of cases, she's treating all of these neurological conditions using nothing but diet. And so that's again why at Apex we make sure diet and lifestyle is the base of that pyramid that everything else is built upon.
I think it's a key thing to say is, like with all of these weight conditions, it can be a very sensitive subject for your patients when they're coming to talk about it. And I know I've had patients of mine who said, I've got a brother, sister, friend, wife, spouse who really needs this, but they don't want it. They don't want to talk about their weight. They find it very difficult to do that. And I think that goes for being overweight and underweight. It's a very, very sensitive subject to broach. And I think it's very key that what you're doing with weight management is nothing to do with what people look like. It's not to do with being fat. It's to do with the risk of disease later in life. And that's what obviously comes back to longevity. We're trying to really optimize their health and actually reduce the amount of fat that's sitting there around the organs. And that's what's going to really cause the damage. Having fat under the skin is not so much of an issue. Brown fat certainly is great to have. And until recently, brown fat was thought just to be in babies. But actually, there's a lot of evidence to say that there's brown fat in adults as well. And the more brown fat we have, the better it is for our metabolism. So all of this, there is good types of fat, but we all know that visceral fat, there's a lot of evidence about this, that visceral fat around the organs can cause a lot of disease. So that's what we're really targeting. And going back to visceral fat, talking about under the skin fat, talking about muscle wasting, all these things, I really like to do body composition analysis on my patients. I think it is absolutely vital. And you look in the press and you see all these people coming out who've had these bad experiences because they've gone and they've got it online and they've not had the follow-up. This is another thing that you see when you're actually having a physician or a nurse or a pharmacist-led treatment plan, is that you can actually get them to have a DEXA scan. You can get them to have a body composition analysis through electroimpedance. You can do lots of different things to actually show a transition and show the trends for things like muscle loss, things like fat loss, looking at visceral fat, all of these different things. And that is really key to actually say to your patient, right, well actually your muscle wasting is a bit faster than we'd like. Let's try and increase your protein amount, potentially reduce the dose a little bit and try and tailor things.
So I'm conscious of time and there are a flood of questions. So, the course obviously will delve into high level knowledge and we'll be understanding a lot more about the patient dynamic. So at what stage would you classify the assessment protocol versus then when to investigate versus which management step to put them on and how to then long-term monitor them and manage that patient is essentially what the
exactly right. There's far too much to talk about that we can talk about in an hour webinar. We could be sitting here all day and we still wouldn't cover it all, but there's so much out there. Yeah.
So we've got people from all over really. We've got GPs and independent nurse prescribers, some specialising in diabetes, and some of them are aesthetic practitioners. We've got a vast independent pharmacists, and they're scattered from all over the UK. Some are interested in getting into longevity, some are already started their longevity kind of practice as well. So, I want to, for those that wouldn't even consider this, because for me, it still seems a bit daunting that I could talk like you guys about this topic and know about what I'm on about and feel like I could turn that into a business model and offer that to my patients. Now, considering in aesthetics, there are far fewer patients wanting to undergo needle procedures to alter their appearance. Statistically, at the moment in the UK, the most recent research for 2023 showed that only 8% of the population that they sampled were having fillers. 27% had considered having filler but never had it, and 60-something% have never even thought about having filler. So we're a minority in the aesthetic space. Obesity, weight management. There's a reason why every single magazine talks about diets and fads and weight loss, and it's a huge popular topic. So the patient cohort potentially for this far outweighs the aesthetic space. This could easily be someone's full-time job, and I'm sure the longevity space is so large they could almost specialize in specific niche areas such as just weight loss or such as menopause, just like you do in aesthetics.
Some people that make a living just from doing nose transformation with non-surgical rhinoplasties, and I did that for a few years, and it absolutely is so big you can easily just use one topic.
So on that actually I actually wanted to ask, so patients, you could easily set up a website that shows you as a specialist. You can promote these treatments. Patients will generally inquire, or if you already have patients in the aesthetic space, that's another treatment you could broach and offer them and have a consultation.
It's a great seller for an aesthetic patient. If you've got an aesthetic patient who wants contouring of their chin and their jawline, and they're sitting there with a BMI of 35, no matter how much filler you put in there, you're not going to be contouring their chin and their jawline. And a lot of time, certainly in my aesthetic practice, I shied away from that conversation. I didn't want to talk about their weight. And it's actually quite an awkward conversation to have. But if you set your practice up so that you're ready to have those consultations. If you have posters in the waiting room talking about introducing your new weight loss medications, then the patient's already preconceived ideas about it. It's actually more sort of allayed to the fact that they could come in and have a consultation with you about it. So they might open up more about that. It might make it more comfortable for you to talk to them. But what I found was difficult, and what I thought you were going to ask is about how do you get into this, and how can I just do one course and start doing this?
I was going to say, that's my next question. I've got a question between that. I want to get to that. Because I need to understand a bit more about the training in this, and what do I need to learn to get started. Because obviously it's an ongoing journey.
Absolutely
right. There will be some knowledge I need to acquire to get started, and then I will build on top of that, almost kind of like building blocks.
Exactly, yeah.
One of the really popular questions we're having while we're on the topic of weight loss medications now is that, I mean, what someone who runs a slimming clinic specifically says 90% of their patients fail long term. They have rebound weight gain. They can't keep the weight off, which tends to be what we understand fad diets, crash diets seem to do. This individual has actually also mentioned they've undergone a gastric bypass themselves in the past, and that they also really are passionate about helping people lose weight, but to keep it off. Now, psychological components, ongoing management with these medications, dietary advice, lifestyle. Can you break it down into the specific categories, like just super high level summarized version?
There's a lot of things going on in that case.
I mean, how long have you got?
And it's not, but the important thing is it's not uncommon. I'm sure every slimming clinic has something like that. So to break it down relatively briefly, the single most important thing in that case is insulin. Okay, the insulin is not going to be under control. When you eat carbohydrates, what happens is the insulin comes in. What happens, the glucose, in fact, question for you, Amrit, I'm going to test you here. So let's say you have a meal, your glucose level rises in your bloodstream, insulin comes in, brings the level back down. What happens?
The sugar from my blood into my muscles as a storage
Does it
mechanism,
really?
or liver.
Does it really?
Well, that's what we've been taught in medical school.
So what happens is when the insulin comes, some will get turned into glycogen stores.
Yeah.
But where does the rest go? Because only a limited amount. What happens is it gets converted into fat.
Yeah.
And realistically, a lot of us eat far too many carbohydrates. We saturate our glycogen stores.
Yes,
So there is...
We never deplete them.
Exactly.
Yeah.
So we've gone to that next part in the chain, which is making it into fat.
Yeah. And in a case like that, what's happening is if you are continuing, it's not just about, first of all, calories in, calories out. I won't get started on that, but there is debate, to put it lightly. So when that
certain individuals genetically predisposed to hold on to calories differently
absolutely
to others?
not. Absolutely not.
I disagree. So there's actually, they're looking at genetic therapy for the GLP-1, GLP.
The hormones.
So the hormones. So there was different.
So
I mean,
there must
not
be different levels of sensitivity, surely, as well, right, to these
So
hormones.
there's
and
no-
fat
there's no-
changes
Yeah.
that sensitivity.
There's no gene that makes you fat. If there was, we wouldn't be alive. Because we would have died off a long time ago. There is genetic variation in hormone landscapes and your ability to respond differently to different food. Absolutely.
I think it's very multifactorial, and being fat is just is such a difficult thing to pin down and sort of talk about in sort of one sentence. There are so many things contributing. Like you touched on, as psychological aspects. There's the biochemical response to insulin. There is the hormonal response as well, and all of these things you've got to try and approach when you're dealing with someone for something like weight loss, and it's very complicated.
I was going to say, I'm sure there's also a bit of a bell curve distribution in the way people's intrinsic metabolism works. So some of us might sit on the higher side where we're subclinically hyperthyroid, but we're not past the clinical diagnosis threshold. So we will burn far more calories versus people that might be more closer to subclinical hypothyroidism. But because they're still within the normal distribution, they don't classify as diagnosis criteria, but they will still utilize energy differently.
So the reason for that is because there's a variation in the application of something called the Randall cycle from Randall 1963, which is dependent on specifically what you eat. But I'll put it this way, this will pique people's interest. So in all my cases where people eat, people want to lose weight, one of my recent patients, I got them to eat double what they were eating, and in 2 months they lost 12 kilograms. So it's not about counting calories necessarily in isolation. It's about what you're actually eating as well, and which is why you get cases like that happening.
I think we can absolutely agree in that. It's, that whole idea of calorie in, calorie out is not true, and it really depends on what the calories are.
It sounds like an oversimplification.
Absolutely. It's one of the worst things that's happened is people putting calories on all the menus now. And I know, having gone to the Cheesecake Factory with you, Amrit, like, blimey, that's scary.
So disappointed in both of you right now.
But that's the worst thing you could do. I'm not saying the Cheesecake Factory's got good calories, but it is something you really got to take into account, is what those calories are.
Yeah. So we've got people from different backgrounds, nurses, independent pharmacists, some prescribers, some non-prescribers, medics, dentists, people international outside the UK. And the common question we start seeing is they want to get into the longevity space, or they want to bolt on the weight loss service to what they're currently already doing in their clinical practice, but they don't yet know how best to do that. And there is so little training out there. Tell me a little bit about the training, the duration, what it encompasses, and then who can get started, what your background needs to be.
So this is a question that we get times and again. I think we had it last webinar as well, and it's one that keeps coming into the email addresses, keep getting on my DMs as well, and it's something that people say is, can I really prescribe these medications? And it's something I thought when I started out in longevity from aesthetics 6-7 years ago. I was sort of thinking, can I really do this?
I felt the same when I had to prescribe Botox.
Is that right?
1-day course with a junior doctor, and I was prescribing a toxin, a neurotoxin.
Exactly, yeah. And then sticking filler in someone's face. I mean, there's actually, what you're doing here is a lot less toxic, less potentially harmful than a lot of the injectables and things we do. So there is a mindset thing that people haven't actually woken up to yet, which actually that all of these things can be prescribed by any prescriber. There is no rule around this. That we have even got an indemnity provider who has agreed to provide indemnity for every single person that comes on our course, and all of our courses are aimed at medical prescribers and nursing prescribers, any sort of healthcare prescriber. So as long as you've got a prescribing ability or a prescribing qualification, be it a doctor, dentist, pharmacist, nurse, or any other prescriber, you can do these courses and get indemnity to go out and practice these. And yes, you can even start practicing on treatment. I know we do friends and family in aesthetics, but treating out and advertising in your local area, you can start the same day. You can start the next day after these courses.
I've got a question for both of you, actually. What about if someone, you said there's international people as well. Do you think this is the same? This is the case as well for other countries?
It really varies in different countries. So we've looked at a few different countries, and this is mainly focused for the UK. We are going to be opening up more things to Europe, Australia, other places as well. But there are, we've got to really look at the UK at the moment. So for the UK, any prescribing process, from the research we've done, in the countries that we've been looking at, majority of the things that we teach can be prescribed pretty much globally. So there doesn't seem to be a huge variation around it. When you cut into some of the really high-level things like peptides, and we're talking about some of the compounding pharmacies and peptides that America is very popular, was extremely popular before the FDA regulation, that actually, you've got to think, is that going to be okay? And then actually there are some countries then that start to limit things a little bit more. But actually with a lot of the things that we're talking about and we're prescribing and we're teaching on the courses, you can go into and you can have some really effective treatment plans that are fine.
So now, I can't hold off the question any longer. We touched upon it earlier, the course. So tell me about, when is it available? How is it available? How is it consumed? How long is it? How quickly can I start? And also, some people here are already in the space of prescribing weight loss medications. They're very passionate about it. What if they wanted to add on more than just weight loss? Yeah. What else would the course allow them to do?
So I think it's important to say that weight loss is one part of longevity, and there's a lot of people who want to just implement just weight loss, and that's fine. You can do that, but you've got to still think about it in the bigger picture about how that leads to a healthy, long life. So weight loss, and I've had people contact me saying I've trained in Ozempic, I've trained in with other companies to learn how to inject these things, but will I learn anything more from your courses? And what we say is what you're going to do is you're not just going to learn how to do an injection on our course. You're not just going to learn how to use a treatment. What you're going to do is actually incorporate that into effective treatment, like holistic longevity treatment plans that actually work. And the issue is time and time again, people have these treatment plans, they come off of the treatment plans, and then it stops working. They start putting on that weight, okay? All right.
So, Abs, I've got some questions for you.
Okay.
I want you to flex your grey matter.
Okay, flex the cholesterol.
I've got some people asking that the stuff you're going into is so high level, lay individuals or the general public would struggle to understand that.
Good question.
I mean, I would even extend to say I struggle to understand a lot of that. Can you simplify the mechanisms for weight management down?
Yeah.
And then also explain to me the process of how is it the training courses work in terms of what is the mechanism? Like, you know, for example, in aesthetic training courses that some of us might have experienced, or the other training we might have had in our current medical specialties, it's either heavily theory-based without any practical application, which then you feel that you're academically ready, but you're not ready to put it into practice.
Yeah.
Or it becomes a shadow zone where you just watch someone do something and you don't really get to participate.
Yeah.
So how does this work?
So I'll answer the second one first. I think that's probably what people mostly want to know about. And I'm sure Matt will back me up, but it's a combination. So it's not that you sign up online and you read some modules and then you're just let loose. You are given all the theory in quite a lot of detail, I think it's fair to say. And there's a live element as well, where there are real life patients wanting to use this service. Myself and Matt will be there. We are going to talk to the patients with you guys, handhold you. You as a student are then going to be speaking to the patient as well while we're there. So you can practice what to say. You can have your notes in front of you so you know the algorithms to talk through, etc. So you get a bit of both, which I think is very unique. Not many, if I don't know of any other course that offers that combination. To answer the first part of the question, to try and really simplify diet down, first of all, it's an extremely large topic, as you can imagine, and this is what my research has been based around for many years. But
how do you broach it with your patients? How would you kind of give them the options?
It's all based on glucose. If you really want to simplify it down, that's it. You have to understand that in nature, we either find a combination of protein and fat, i.e. animals that we eat, or protein and carbohydrates, i.e. plant-based. The only food in the world that has all three macronutrients together is breast milk. Why is that? Because when you have multiple different types of macronutrients together, the cell will prioritize one over the other. And we have known this, like I said, since 1963. Why does that happen in breast milk? Because then it puts you into storage mode so your baby can grow. So when we go into adulthood and we don't have that, that tells you a lot about what we're designed to metabolize. And it all comes down, to put it simply, to glucose. Glucose triggers the insulin spike. Insulin is a growth hormone. It puts you into storage mode. It makes you hungry again. If people are interested, you know, I don't eat any carbs. I think you guys know I eat basically just meat.
How do you survive?
And I never get hungry. My lean mass is increasing, even though sometimes I'll have 1/4 kilo of butter in one meal. My body fat never goes above 8%. I hit a low level of ketosis every day. And I have no issues whatsoever. So it's all to do with glucose. And when you come on the course, we will talk to you about these different macronutrients and specifically how the body actually interacts. In our foundation and advanced, we don't throw it all at you because it's a lot.
I mean,
it's
such
a
big
heck of a
topic, that's what
lot.
I mean,
Yeah.
how to digest it.
Exactly. Was that a pun?
It should be.
But then we have masterclasses after, going into different things, and one of them will be things like this for people to build up their knowledge.
So I'm gonna put myself into your course.
Sure.
I'm on your foundation course. I'm on your advanced course. I'm guessing they're best combined together.
Yeah, absolutely
With a
right,
bit of
because
a gap,
that will essentially show you how weight loss can fit into all of the other things. And I've already mentioned, once the weight loss, you need to build that foundation on the hormones, you need to do the diet and lifestyle. And if you do just the advanced, you'll find about weight loss and some of the other things, but you won't understand that real sort of diet and lifestyle changes and the hormone management that needs to come before that.
So I can attend from a multitude of medical backgrounds. So we can target dentists, nurses, prescribing pharmacists, doctors. We can then attend the courses to learn this knowledge about the physiology of how the body works and how does it utilize and how those hormones impact our hunger and all these factors.
And then where the drugs fit into that.
Yeah.
And then we understand how to actually, I'm guessing, interpret or manage a patient as an individual.
Yeah,
exactly. And I think one thing, before we go on to talk more about the courses and essentially announce what we're going to be doing, one thing it'd be nice just to touch on is the intermittent fasting. Abs, and just maybe talk a little bit more about intermittent fasting and the benefits that has on both cells and also on disease that there is in the body.
So the intermittent fasting, if you think about it, is basically what we're designed to do, because we didn't evolve with Deliveroo. I mean, I love Deliveroo, as many people know, but we didn't evolve with that, right? Now we don't even have to leave the house. They just come with the bag and drop the food off. Before, we had to go with a spear and hunt something. So intermittent fasting is, to our cavemen ancestors, just a part of life. And that tells you something about what it does for us. And when you do that, it gives your body a chance to work off the fat, say, around the liver, which is not meant to be there, and instead keep fat where it's meant to be, say, subcutaneously. So it allows you to burn off things putting it in layman's terms there, burn off things which are not meant to be where they are, and you get left behind with things in the right place instead, which allows your organs to function better. It allows your cells to clean themselves up and recycle things in autophagy. And it basically tries to kind of reset your metabolism. Doesn't mean you do it and suddenly you can do whatever you want, because if you do it and then you go back to KFC, you've kind of, I think it's fair to say, you've wasted your time. So it's, again, that's why it's part of a bigger picture, and it has to be implemented across everything that we teach you.
And that fast movement has real changes on sort of a very small level to a macro scale, hasn't it? So, I mean, even the sort of we're talking about antioxidants, so superoxide dismutase, an absolutely amazing effect on that to really stimulate the antioxidant properties to protect against some of the damage you get from free radicals. It also has brain-derived neurotrophic factor. That has a really big effect on that in terms of your brain function. So it can actually increase your brain function when you're at work from intermittent fasting.
Yeah.
Certainly when I'm intermittent fasting, I find my performance goes on through 6, 7, 8, 9 p.m. I'm still there performing when I'm fasting. Whereas if I have a carbohydrate lunch, heaven forbid, abs, I have a carbohydrate lunch.
I'll crack the whip.
Then don't do it when abs is around anymore. But if I have carbohydrate lunch, by 2, 3 o'clock, I'm always feeling that low because you've got that insulin spike, you've got the glucose disappearing, off to make fat, to go into your cells, whatever it might be, and you just dropped and you've hit that lull in the afternoon. So I find really intermittent fasting can jump from that cellular level all the way up to that macroscopic energy levels.
Yeah.
So I just want to take a moment to thank all those that are watching live, and for those that are asking if they're going to be recorded and available later, of course it will be, but the benefit of staying is you get to ask questions and we'll answer those as we go along. Now we've still got a good 20-25 minutes to go, so I do want to hear many more of your questions. I'm sure there are people out there wondering things and want to ask things. Now is your chance to ask these experts the questions. I want to know, how interested are you in finding out more about the course? Because I really want to know the ins and outs of the course, because I'm thinking of how do I implement this into my practice. I want to get ahead of the curve. Aesthetics 10 years ago, there were very few hands delivering these treatments. Pretty much like right now, how there are very few individuals specializing in longevity, offering longevity-based services around even the UK, and patients have very little awareness of what is available. And as that grows, there's going to be a demand for these treatments to grow, and it's a very scalable model as a business owner. So I'm excited to know more. So do drop into the comments your questions and how eager you are to find out more about the course, or if there's anything specific. I've got one question, and it's cropping up a lot in the chat: CQC registration. Dermal fillers, Botox, no CQC required. PediaThread, CQC required. What about these treatments?
So it depends on what you're going to offer. So you can offer obviously diet, lifestyle advice, absolutely fine with no CQC. You can offer supplements, fine with no CQC. For the prescription or blood testing, you need to have a CQC premises. So blood testing you can outsource. You can get third parties to do your blood testing. So that's not a problem. It's prescriptions is where it comes into, and there are ways around this. So there are a lot of places that offer you practicing privileges, and you can register your clinic as a clinic in one of these areas. For example, there's plenty on Harley Street. I'm sure you can't walk down the street without bumping into a third party that's offering their room out to rent, and you can actually hire these. And even if you're using the room itself maybe once a month or even once every 6 months, as long as you've got practicing privileges there, you're covered by the CQC, because that's that environment. So you can be prescribing these medications because you have practicing privileges.
So you don't have to physically be in the building because you have privileges in a CQC registered
Exactly
building.
right.
And even if you do it kind of tele-consultation, virtual consultations remotely, you're extending that CQC from where you have practicing privileges to allow you to offer this service remotely, because that, I'm sure, will open up the door to a lot more individuals being interested in this.
Yeah, no, exactly right. So your practicing privileges come with where your clinic is registered, and you can have your clinic registered in a third party that has CQC, and you can still offer teleconsults. So to give an example, my colleagues in plastic surgery, a lot of them are registered in a hospital or in a clinic that have CQC registration, but they do a lot of teleconsults. They prescribe things remotely. They do other things in addition to what they're doing there, and they're still covered by the CQC. There is also another option. If you're going to do a lot of this and you don't want to have a third party, you don't want to use any money, you don't want to be setting up appointments with that clinic, then actually you can go into CQC, and there's actually some third parties that we're partnered up with who can do that easier for you. And so that involves filling out, because the main thing about CQC that takes a long time is filling out the forms, and that is the hardest thing, particularly for an online clinic, because there's no site visit, there's no visit of your premises. If there's anything, they come and just see where you're based, which might be your office, your home office. You know, they don't actually, there's no clinic for them to view. So for CQC registration, if you do want to get CQC registered, you can work with one of our third parties that we've partnered with, and they will actually do all the paperwork for you. And all they do is they then set up an interview with you and the CQC that you can have then, and then you have a CQC registration badge, which if you're doing aesthetics already, is not a bad thing to have anyway, to move forwards. But if you're doing things virtually, then that's a lot easier to do.
So I mean, for me, this model works really well virtually, because for patients it's convenient, especially because they're not coming for a cosmetic procedure, they're actually coming in for a consultation. Your expertise, it's your brain they're essentially investing in and getting access to. And I'm guessing these medications, how does an individual go about, you know, say you prescribe me Ozempic, what's the process there? Where does that prescription go? How does the patient get it? How does it work?
So it's something I wondered first. Do I write this? Do I send them to a pharmacy? They go to Boots and they go and pick it up, and things like. There is that option, especially with something like Wegovy or Mounjaro, because they're becoming more common. However, they are introducing slowly into the UK, and there are main providers that have them. We've partnered with a number of pharmacies that actually it's so much easier than that. You write the prescription either in your EPR or you send it over to them. They then take care of everything. And what's better is they normally give you a difference between the RRP and the wholesale price. They actually give you a cut of that to the clinic as well, which is passive income essentially for you for taking that patient through the pharmacy. So it's a much more seamless process than giving them a prescription. They have to then go fulfill that somewhere else.
Now, say if I ended up on a drug like Wegovy, Mounjaro, Ozempic, what as a patient, I mean, I'm sure there'll be people that really don't know a lot about these medications. How does it take? How often do you inject it? Where do you inject it? How long am I on it?
So I think there's a lot to go into that. There's different regimes you can do. There's different starting, continuing, monitoring things. I think that's, we're obviously running out of time a little bit on the webinar. That's something really that we go into a lot of detail in the courses, and that's really, you can actually sort of see how do you start successfully, how do you tailor it up, how do you maintain it, and then how do you stop it at the other end. And I think all of these are things that you really need to attend the courses, but also, and we'll talk about this more, but actually some of our subscription webinars where we'll talk about do more Q&A sessions in small groups, and we'll be able to focus on these as well. But I'm conscious that it's now sort of got about 15 minutes left, Amrit, so I'm thinking it's probably a good time to finally get on to talk about our courses.
There are a lot of people asking specifically about the questions, but the thing I do want to know with the answer about the courses, first of all, start with CPD certification.
Yep.
Do I get my CPD points?
You absolutely do, yes, absolutely right. So we'll talk about that, and I'll talk about what the offerings are. Shall I go on to those?
Yeah, I mean, I want to know more about the actual process.
Yeah, absolutely. So we've, Abs and I have been working this a long time. It's been about I've had 6 years of researching longevity medicine. We've been writing these courses for the last 2 years, and we've been putting together all of this stuff to really give someone like I was, 10 years ago, like Abs was as a dentist, like you are, Amrit, someone that chance to go from doing a clinic in aesthetics or from doing nothing, just being in the NHS, to actually transitioning completely into longevity medicine. And that's why we've designed the foundation and the advanced course. So we've mimicked very much the model that Medical offer, and we've got a foundation and advanced course. The foundation course will cover everything from diet and lifestyle optimization, hormone management in menopause, so HRT, so estrogen replacement, progesterone, protection of the uterus, and also testosterone therapy for women as well. But we're also then going to talk about male andropause. We're going to talk about testosterone replacement for men, how to optimize that, how to get into the right range. We're not talking about jacking people up on steroids. We're talking about optimizing it to get them healthy and to get them really having good results. And then that's going to be the foundation course. Okay, that also then builds a foundation for the advanced, because as we've shown you in that longevity pyramid, you can't really start the advanced without knowing these two things first. So then on the advanced course, we're really going into more details into weight management. So we're talking a lot more about what we've talked about today. We're also then going to be talking about biohacking and performance optimization. Now, biohacking, people think, well, what's biohacking? Isn't that just a non-medical sort of people just self-experimentation, CRISPR in their garage? And that's the traditional view of biohacking. But what we are doing is taking that biohacking and we're converting that into a much more performance optimization, medical-based approach. So we're looking at what the evidence is out there, and we're applying that to biohacking principles to really improve mental and physical optimization. And then finally, the health healthy aging is really all about how you take that whole package, how you take that really healthy person you've got through those other 4 tiers and last that as long as possible. So stave off disease, they have dementia, cancer, heart disease, all these things as long as possible to give them the healthiest life and the longest life possible. So that is the advanced course. Now, we're launching the foundation course and the advanced course. They will be going live in July, and pre-orders are going to be live, if not now, then in the next few minutes, and certainly at the end of the webinar. And there are some special offers for pre-orders as well. So we have 2 packages that are exclusively available for pre-order, and when we go live, they'll be no longer available. So it's something that's really worth capitalizing on now. So the first package I want to talk about is our exclusive launch package. Okay. Now, our exclusive launch package is trying to take you as someone who's starting off in longevity medicine, and it's trying to take you all the way through to the top of that apex, so the pyramid, the top of that pyramid. So in that exclusive package, not only will you get access to the foundation and the advanced e-learning courses, but you'll also get a live training day. So that live training day is going to be myself, Abs, and a number of our other longevity experts. And that is going to be really key because that whole day is going to be a whole day clinic. That is going to be consulting real life patients, talking to them about the problems, taking them through that journey. So we start off in the morning with diet, lifestyle, hormone optimization, and we're working all the way through to human longevity and healthy aging at the end of the day. By the end of that day, you'll be so comfortable managing these patients, you'll be going home and you'll be ready to open up that clinic and start offering this in your clinic. But not only that, we're also including monthly live webinars just like this, but with the smaller groups with a much more detail, going into much more Q&As, people who have done the course who can actually ask questions, and we can sit there and we can answer those.
More aftercare webinars.
Exactly. So aftercare webinars like you work like the really successful ones you have at Medical. So really just trying to talk through the courses, anything, questions that may have come up, we can talk through that and help implement that into people's practice. But not only that, we've also got partnerships that we're working with. So there's exclusive discounts and supplements. So for example, we work really closely with a supplement provider that's going to provide not only a 10% discount to all of your patients when you go out and offer these treatments, but actually a 20% kickback to yourself as well. So every time a patient buys a supplement through this company, they will give you 20% of that revenue comes back to your clinic, completely passive income. So all of these deals, everything is going to be bundled into this exclusive longevity package. Now, this package is not going to be available after orders go live. This is only for pre-orders. So once courses go live, there will be no launch bundle. This is just for the pre-orders, and that is 1799, and that's on our webpage. If you go onto our webpage, you go onto courses, you can pre-order that now. Now the caveat is there are only 50 spaces. And I know already that we've got about 20 to 30 people who have already pre-ordered explicitly for that launch package. Even though we didn't advertise that launch package, it was just up on the website. People have found it and said, I want to book this. So I know that there's going to be a lot of people who now hopefully are going over there, seeing this exclusive launch package is there and purchasing it. So there are some dates up there for the live training day. That's going to be in London, and that is going to be with myself, Dr. Abs, and a couple of our extremely trained expert trainers. And that is going to be for the first 50 people that book. Once the first 50 people book that, because it's not a big money making bundle for us. What we're trying to do is get the awareness of longevity out there, because what we are trying to do is throw everything in there so people can really see what longevity medicine is.
For me, the most exciting part of all of this is actually that you offer this in-person, hands-on approach where it's small batches, it's going to be a very intimate cohort almost, rather than just mass numbers. Yeah. And also the fact that they get to actually run through a clinic where they understand and get to see the process,
how we do it,
how it's done, but to actually do it with you guys rather than just shadow. They actually get to be involved in that, and the aftercare, so that there's a support mechanism there. So should they feel a bit apprehensive about any individual management, they can come back and then find out more and really get going.
Absolutely. I think it's key to note that it's not for everyone. I mean, some people who might not be in the UK still want to know a bit more about longevity or might not be able to get back to London. There is a Foundation Advanced bundle, which is just the e-learning for $1,099 plus VAT, and that is just the e-learning bundle. but the launch package is so much more. And if people can get into London, we are offering that. But not only that, we're actually offering, we will be releasing details about this soon, but a VIP package upgrade, a bit like we've done with Medical, whereby you can book a hotel and a dinner essentially with myself and Abs as a whole package. So not only do you get the whole training day, you actually get a dinner with myself, Abs. We get to
Carb-free.
bore you with how bad carbs are and how we should never have any sort of high fructose corn syrup, certainly. But we're going to be doing that as well, and that's going to be coming at a later date. So anyone who pre-orders, any of those 50 people who pre-order, they will get an exclusive invite for this dinner as well. So that'll be an optional add-on if they want to join us for that. But yeah, so the bundle is very, very popular, and it is going to be selling out pretty quickly. So it's definitely worth getting on there and ordering that as soon as they can.
So next steps wise, they can go to apexmedicalacademy.co.uk. I mean, I've seen the link is in the chat box for those that want to click on that link and go straight there. They can explore the course package offerings. These are very much early bird offer packages only, right? So once it goes live, or I mean, before it even goes live, they could sell out in that short space of that 50 cohort. So they can make their way over, they can get that today. And then what would be the next steps? They'd attend some of it virtually, and then they'd do the in-person stuff?
Exactly right. So the foundation, the advanced e-learning will be available to them in July, and that will be able for them to consume that at their leisure, but I definitely recommend consuming that before the live training. The live training dates start in August, and we'll have a few dates there. Those dates are limited because of the limited number of people and obviously the limited number of us. So it's that's why the package is so limited, is because it's really is going to get a lot more hands-on time with the two of us and the rest of our training cohort.
Now, for some of those that want to go the whole way, that want to become future Matt and Abs, and they want to be experts in this space. So I understand you mentioned something earlier about masterclasses. Tell me a little bit more about that.
That's right. Well, we're working on them at the moment, aren't we?
Yeah.
So tell more about the performance optimization one you're working on.
So we have the foundation, we have the advanced, and then the topics that we cover in there, like hormones and diet and things. Obviously, 2 courses is not going to make you a world expert. So we have more on top of that if you want to go even further. So the one I'm working on now is the performance optimization. And again, what's unique about this course is that it's not just the fact that we have this practical element which no one else has, but also even yesterday I was at one of the Arsenal players' houses talking about things like performance optimization. So I'm bringing that experience where I've worked with international teams like the England cricket team, Bayern Munich, Inter Milan, Arsenal yesterday, etc. And we're putting it in this course, which is very, very unique. And I don't know of anywhere else where you get to see that kind of experience. And so all of that is going to be put into our masterclasses, which is where you can really push even further with your knowledge on these things.
So I'm guessing they're going to be specifically focused on
exactly
certain areas,
on the
like
different
weight
areas
loss and menopause and biohacking or performance optimization.
Exactly right. So this is the performance optimization one. I'm working on an andropause one at the moment, which is all about how to tailor your testosterone levels to really hit specific therapeutic windows, how to potentially dip into super therapeutic windows, people who really want those extra gains, and do it safely. So these are all sort of very high level concepts that you've got to understand the basics, just like Botox and fillers. You can't start your training in Botox and fillers by doing a non-surgical rhinoplasty. You've got to start somewhere, and the Foundation Advanced just really gives that introduction to longevity medicine and gets the ball rolling. And then also from that, they will see which area they particularly like. Just like on the Foundation Advanced course, I can remember I hated tear troughs. Still do. I hated tear troughs, but I love noses. And I thought, I want to do some more of that. And then I can tailor my treatment in that, and so my training in that. So same thing will happen, I think, with our Foundation Advanced, that people see what they want to get into, and then they can start really honing in and focusing their clinics.
But just to note, it doesn't mean you jump to the masterclasses. It builds on what's in Foundation Advanced. So without that, you're going to struggle to really implement it and even understand it as well.
And I think really key to mention as well, which we have at Apex Medical, is a community. And the community, when you sign up to any of our courses, you're automatically adopted into the community. And that is very much joined by myself and Abs. We're very active. We answer questions. We can sort of talk back and forth about specific cases. We have the monthly webinars, the Q&A sessions that we'll run, and we also have a lot of other things that we do as a community that is really there to try and help support people as they grow into longevity, because I think you need a lot more support in longevity medicine than you do in aesthetics at the moment, because it's so new and people just don't know so much enough about it.
So we're 2 minutes to our end of our webinar. I'm going to push it a couple of minutes extra, just so we can get a couple of Q&As in. So for those that still have any burning questions, drop them into the chat below. I'll take the first couple that come in. I've got one already over here. So when it comes to longevity protocols, someone's asking a question about conception or trying to conceive and weight loss management. Is there anything to consider there? So for those looking to get pregnant, but there's also in the process of losing weight and they're on any of these injectable medications?
First of all, it's a big answer, so I'm going to compress it. So this is not the full answer. But
attend the course for that.
Yeah, exactly. But the better you are metabolically, the more likely your child is going to be born healthy, essentially. So there is definitely a link. And
I mean, we see that naturally
absolutely.
in terms of severely underweight or severely obese
patients
can't conceive.
Exactly. And it has a big role in hormones. Again, hormones are crucial for conception as well. So there is a link, and that's something we can go through as well.
Okay. Any other questions do come in. I've got one more. I'm going to ask this one. This could be the last one, actually. So someone's talking about Saxenda, which they're asking, is that the same as Mounjaro? And they're also saying, are there any contraindications, like absolute contraindications, no-nos on who can't have this?
So I'll start the answer to the first bit. So Saxenda is liraglutide, whereas Ozempic and Wegovy is a semaglutide. Liraglutide is a once daily treatment, once daily injection, whereas semaglutide is once weekly. So when semaglutide was introduced, that's actually what's really sparked this interest in weight loss medications, because suddenly you go from an injection you have to have every day to an injection you have every week. So it's much better from that side of things.
Okay, I mean, I think we could go on all night. Are there any more upcoming webinars for those that are really interested in coming on to the next ones?
Yeah, absolutely. So we've got another webinar in 2 weeks. So I think that's the 28th of June. So that webinar is going to cover more about andropause, testosterone replacement. Sorry, it's the 26th, thank you. 26th of June. It's also a Wednesday at 6:30, and that is going to cover andropause and menopause, and we're going to be talking about that. We've got invited Harriet to come and join us, who's going to talk a bit more about menopause on that side of things, and we're going to be talking about how hormone management also ties into longevity and how you can actually introduce that into your clinic. Because I think a lot of people think, I'd like to manage menopause patients, but I've no idea how to start doing that, in a similar way to weight loss. So again, continuing this series, the Launching a Longevity Clinic series, is all about how to introduce hormone treatments into that clinic.
So for those listening or tuning in today, how will they sign up to that? Will they automatically get an email or
so if you go onto our website, you'll see on the events page there is another webinar that's there, and just click register for now for that. You'll automatically get the emails, but if you click register now, you also have an opportunity to put in your questions, but also you'll get all of the latest and updates about our courses. So just, I guess, to finish off with is just to mention that our courses are now live. It's now 7:30, so if they weren't before, they are now. So I would definitely recommend getting over and look at these, checking out our courses, see what we're offering, look at the Foundation Advanced course, look at the bundle together, and ultimately look at that exclusive launch bundle. So if you really want to get your teeth stuck into longevity medicine, then the exclusive launch bundle is a great option for that. And just remember that there are only 50 spaces, so I suspect they're going to go pretty quickly.
So, I mean, I really enjoyed that. That was really, really insightful to get a little bit of a snippet into that. And thank you all for tuning in, and looking forward to seeing you on the next one. I'm excited to be in the chat box on the next one as well. And I know that andropause, menopause is a super hot topic and something that is going to rapidly grow as we're having more of an awareness in this sector over here. So I think that's one not to be missed. But in the meantime, for those that don't want to miss out on the future training courses, apexmedicalacademy.co.uk, have a look at the courses. Sign up to the next webinar, but before they sell out, you don't want to kick yourself. You want to have a look and get onto the early bird offer. Once they're live, I'm guessing it's going to kind of then follow on with the masterclasses. So the first cohort are likely to succeed in setting up and establishing a longevity practice.
Absolutely right. There's only 2 of us, and we can only train so many people so far. So it's it's going to be the people who get in there first are going to get on that elevator very quickly.
Excellent. Well, thanks everyone, and see you on the next webinar. Any other questions, you can contact the team via the contact us page on the website, as well as also the social media platform. On Instagram, it is Apex Medical Academy, at Apex Medical Academy. Looking forward to seeing you guys in the next one.
Great.
Thank
Cheers.
you.
Thanks.